Tafadhali. Okay. Mercy from Eldoret, good morning. Goes on to say, hello, Shiko and Doc. Wanted to know if it's possible to track and get a baby boy, like determine a preferred gender. Okay. All right. So
yes, it is possible.
The old question of how can I get my preferred gender?
Absolutely.
When I get my baby?
It is a process. It's not possible. The amount of time that I see on this show is so little, but true. We look at the day after your menses, or from day one of your menses. That's the first day of your drop of blood.
Yeah.
We look at the 13th day. We also want to talk to the father of your proposed pregnancy, because he has to reach a time 5 days prior to your ovulation day, which we can calculate.
Yeah.
He stops ejaculating completely,
What?
both with you and with anybody, or even if he's a masturbator, he doesn't ejaculate for 5 days. And then the style,
Oh God, don't tell me that
we cannot
works.
now go into.
Yeah.
So there are about 7 teachings that we shall give her. I have a small
And these are
book.
proven methods, Dr.
Oh, absolutely. They go up to 75 to 90% success.
So what we're telling our dear viewer there is that they need to get in touch with you as well, so that they can be able to calculate.
Absolutely.
And you can
We'll need about an hour with them. It's not just like this at which day.
Yeah.
No. There is an explanation. There is a douche, a special douche, which is acidic or alkaline.
Wow.
There is a special type of a food. There is a type of how many times you meet your man. It's all a long story.
Oh my gosh, and there are families today who are like, my God, I have 4 boys back to back.
And I
did not plan it.
I am one of them.
Okay, so go ahead and of course see Dr. Kibe, and of course visit his practice for any assistance you need in regards to, choosing your gender. Another question, please, as we have probably about 10-15 minutes to go with Dr. Harry. Mercy, I hope we helped you there. Let's see what else we do have. Okay, Elsie says, good morning. I am 28 years old. I had 2 abortions when I was in campus that I'd back in 2016. So in 2019, I got pregnant again, and unfortunately, I had a miscarriage. It happened again last year. All right, so from what we gather, 2 abortions, perhaps her concern is, did this contribute to my miscarriage?
They do in a big way.
Yeah.
Make sure you understand that a pregnancy is like planting a tree. This is a tree, the human being. And you literally, physically, and traumatically uproot the tree.
Wow.
So what have you left? A scar. And this scar may heal and you stop bleeding. But that scar is there in the uterus, in the endometrium of the uterus.
Right.
So you have a scar this side, you have another scar this side, you have the 3rd scar due to the miscarriage, and now you have the 4th scar. It's just like, even on people's legs, you see scars from different
there's
woods.
Extensive tissue damage.
Absolutely.
On the inside.
That is why I keep telling them, if they have to, I'm using the word, if they have to, or if a doctor finds medically, I need to terminate this pregnancy, let it be done by a professional, so that we may not scar the whole of the and I'm warning girls in campus, because she mentioned that she did it when she was in campus. Girls in high school, girls in tertiary colleges. Please, before you do an abortion, think twice and look for alternatives.
Yeah.
Because you are scarring your endometrium of the uterus, and the future, it's only probably your God who will help you.
Who knows? And the saddest thing is that a lot of these abortions, obviously, like you said, are quite botched. And the brutality, even on the woman's body, it's frightening to even think about it, that you, first of all, may develop complications, or may never be able to have a child.
Earlier on, you said I practiced in India.
Yeah.
In India, abortions are legal. I used to have classmates who will tell me, you watch my experiment while I dash for an abortion. You know, it's not a big deal.
Yeah.
And they would do it and come back to class the same hour. So you go to practicing gynecologists there, and you find a whole line of people who want to abort. It's illegal.
It's legal.
There's nothing barring them from. But then they are done against a certified practitioner who knows how to go about it without scarring.
Right. Okay, Dr. Ari, as we have probably 10 more minutes, let's see how many texts or at least questions we can answer in this short time. Carol Stiles says, good morning, Dr. Kibe and Shiko. I love this show. My question is, I love wearing thongs. Okay. I feel comfortable in them and also cause my body shape. Can they have an effect on my health in future? Absolutely. Well, there is one hygiene specialist who comes on the show and speaks completely against types of underwear or undergarments.
I'm the second one.
But for you, Dr. Kibe, how do undergarments actually affect your health?
In big ways.
Right.
One is like thongs.
Right.
Because of the narrowness and the material that makes them, quite often they penetrate inner than...
First of all, can I just stop and take a breather here? Because I'm shocked at Dr. Kibe's age. He even knows what a thong is.
Who doesn't? I live in my 20s, Ghana. All round.
So this thong is a no-no.
It's a no-no.
Right.
And thongs also, if somebody had, for example, conditions like other conditions that we may not have time to discuss because of time, something like endometriosis,
right,
and something like endometritis, pressure on the lower part of your abdomen makes blood and other liquids that are supposed to flow down to regurgitate upwards. Oh, I don't know whether
that's a bad thought.
That somebody wears it and was just about to start her periods. So what will happen to the blood? It will be sent. If you blocked this river next to us, if you placed these stones and I don't know, sand like and gunias, what will happen to the upper part of the river?
Back up,
yeah, it will back up and is like blocking sewage. And it will go backward, upwards, and it will even worsen conditions like I mentioned, endometriosis, a topic for another day, and endometritis, and pressure on the, and sooner than later, you know, thongs can also bring about infections easily. Look. We say there is a neighbor. Urethra is neighbor to the V, and they are neighbors to the backside, where we go for long call. And thong will keep pulling what is underneath the backside coming up, and it will bring the chaff from down there, the backside, to the front, and it is full of bacteria like E. coli.
That fecal matter is...
The fecal matter is...
Okay, so in short, they may be sexy to wear. Your husband or your partner may think they are quite sexy, but health-wise, no.
It's a no-go zone.
It's a no-go zone. All right, Carol Stiles, thank you so much. Let's see another one. George Ibrahim, hi, Dr. Ari, I need your advice on this. Every morning when I wake up to pee, I feel some pain on my penile tract, but during the day there is no pain. Could I be having a problem?
Absolutely, yes. He's having what we call urethritis. Could be non-specific urethritis, could also be urethritis from gonococci, from chlamydia, from sometimes we even these days get herpes. And after flushing, you know, once, twice, what happens is that the sensation of pain is no longer there because it's just like putting...
There's like relief.
Yeah, there is a relief. But the bacteria are still there. I would advise him to go early in the morning, pick midstream urine in the morning. Don't place your urine in your own bottle. Go to a lab, ask them, they give them for free, ask them for a bottle,
get it tested.
Carry your urine, and it must be tested within 45 minutes of collection. So that, and we can also do a culture and sensitivity of this urine to find out what exactly, you know, down there, as the urethra exits, there is a widened area in the glans penis, and that widened area sometimes gets mixed infections and urethritis and inflammation of the whole system. And it can go up to the kidney, by the way.
Absolutely. And I will, you know, back up what you were saying, because when we did have a urologist here from MP Shah the other day, just his experience with men having such challenges, they describe it as excruciating pain.
Very severe pain.
Very severe pain. Just going to the bathroom alone for a man, it is...
He sits down, he wakes up, the pee doesn't just come. If it does, it will come in drops, and it can be very, very painful.
Okay. All right. So Ibrahim, thank you for your question, and we wish you a quick recovery. Please go check that out. Last or one or two questions as we say kwaheri. Let's see, Director, what we have. Smiles says, good morning, Shiko and Doc. Occasionally, I feel pain on my lower right side of the womb, especially when my periods are almost. What could really be the problem?
That means that we could track this to the ovaries.
Okay.
We have very many conditions of the ovaries. We could be having probably cysts of the ovaries, and cysts again, and just like we talked a little bit about fibroids, is not an STD. It's just that the eggs did not just jump out or mature up, or they did not ovulate. They didn't get out. So she could be having cysts. It's also possible that she has an infection, and quite often we have infections at the terminal end of we call it the fibrio end of the fallopian tube. Right. And if it is infected, if one side is, she could end up even with blocked fallopian tube, what we call salpingitis. She could be having an inflammation near the ovary. Let her go for an ultrasound scan, focusing specifically on the terminal part of the fallopian tubes, and focusing also on the ovaries. Okay.
All right. Last question, Bwana Director, before we say kwaheri. Hi, Doc. Which is the best family planning for somebody who has a big body? Again, okay, I guess we already touched on this, but just to cap it all.
I want to say something because it has come up several times. I want to say family planning and the methodologies is a bigger issue than what girls and women want us believe. It is something that should be discussed in front of your husband or boyfriend and a specialist yourself. And you should, I said, I've written a small book on all the 12 methods in use in Kenya and the side effects of each, because none of them is 100% good, and some are worse than others, like we mentioned. And this is now to the providers, the health providers. What she said has an interest, because she's talking about a big body. I want to tell you, health providers, I want you people who place those IUCDs. Some uterus are uteri. Some uteri are huge, like this ball. Others are smaller. Others are double, like the girl who said that uterus could be bipartite. Now, so don't pick an IUCD or a coil or a copper T, any size, and throw to any woman. It's very important. It's very, because that's why you hear some men say, naisikia, I can feel it. And some girls say, ilipotelea huko ndani, because she was given the wrong size. So whatever it is very important that the provider studies. I mean, even ordinary life. Specs, you are not going to wear my specs. The chin bone, mine and yours, are completely different. And so is David's. So the same thing with placing IUCDs, and the same thing about placing implants, and the same thing, like I said, do not give certain women, preparations with the hormones. Some have varicose veins. It will be affected. Some will end up with the what we clots, blood clots. Some will end up with the
which are life-threatening, by the way.
Let it be a big discussion. Don't just say where my hair was being done. A woman told me this is the best method. Which woman is this doctor in the hairdo place? Please get professional advice.
All right, and so there you have it. That really is the clarion call. Please get professional advice, especially when it comes to your reproductive health. Dr. Kibe, in 1 minute, because we really do have that 1 minute, please tell people how they can find you.
Yeah, I'm in Coffee Plaza, the headquarters of Coffee Board of Kenya, near the Coffee Angle, near opposite the railway station.
Okay.
I now have another place in Theka. It's called Study View. Study View, right opposite the bus station and Matatu station to Makongeni.
Okay. So this is St. Mary's.
St. Mary's Cottage Hospital.
Okay. St. Mary's Cottage
They are
Hospital.
cottages.
Yes.
That means split.
Right.
St. Mary's Cottage Hospitals, Coffee Plaza.
Yeah.
Let me give them my number, but don't call expecting to be treated
over the phone.
Over the phone.
Okay, so write this down very quickly.
0722 534444. 0722 53 4444. Please.
Wow. Yeah, pretty easy number there. 0722 53 4444 is how you can reach Dr. Ignatius Kibe, gynecologist, obviously with St. Mary's Cottages.
SMSs only.
SMSs only.
Because it can interfere. Like when I'm here, I can hear the phone is calling.
Right.
Please, SMS only.
Okay. All right. So thank you so much. We really appreciate the feedback and the questions that came through today. We hope that it has been helpful, and we'll be sure to invite Dr. Kibe once again on the program. But Dr. Kibe, asante.
Thank you very much, viewers. Asante sana. Thank you.
All right. And on behalf of everyone right here on The Breakfast Show, thanks a lot for watching. My name is Shiko Kaitani. Have a beautiful day up ahead. Bye-bye.
Thank you. Bye.